Hi, I'm Dr. Kiran Kumar Lingutla. I'm an orthopedic spine surgeon working at Yashoda Hospitals, Somajiguda in Hyderabad. Mr. Logan came up to me with complaints of ongoing chronic low back pain with bilateral radicular leg pain as well. His pain was quite intolerable and his walking had become quite an uphill task. He has tried various forms of non-operative management, but unfortunately his pain symptoms were not resolved. He also had a history of myelodysplastic syndrome, and on admission he was also diagnosed to have AML with low platelet count as well. So we had to transfuse platelets, get him optimized for surgery, and then I undertook, after initial investigations, we underwent surgery in the form of L4-5 left-sided transforaminal lumbar interbody fusion, following which he has recovered quite well, and he would like to share his experiences to us about his visit here to Yashoda Hospital, Hyderabad. Mr. Logan.
Thank you, Dr. Kim. My name, as it said, is Mr. Ndairo Logan. I'm a Rwandan, aged 65 years. I was born in Rwanda, but then educated in Uganda because of the political upheavals that took place in our country. Those of you who can read, you can read, it's a bad history. So I grew up as a refugee in Uganda. Then I studied as a mental health nurse, registered mental health nurse first. So I was on physio, this and that. 2004, I had not had anything to do with my back problem. So this back problem came actually in 2007. I started with a pain to the toes up to the back here in the left leg, and I was so disabled that I could not even bend and bathe. I could not even bend and put on socks. I could not even bend and dress myself up. So I was in a terrible dilemma. And even my leg started to contract. I had started having the leg up, not as the other side of the right one. Then 2015, it came back. I don't know what, something, with the back, anything. If you sleep badly, if you walk badly, so 15 it came back full force. I saw the very doctor who had done it, who had given me the chemotherapy before. He recommended another dose, but this time the dose was useless. So I kept in pain, intensive pain, and I am a government worker. So sitting was a problem, standing was another problem, teaching was another problem, so I was in dilemma. My back was there always. It was now, actually, I didn't know what next steps I would take, because I started moving, not really balancing my walking. And the shoes would make some noise in the corridor. People would understand it is me passing, because I would not lift proper. I had really reached that level, that India has got specialized doctors, experts. Two, it has the cheapest drugs that we people can afford. Because I knew how bad my back was. It is my wife and a few friends who know that. If I get the expertise I do understand is in India. Yeah. I asked Dr. Kiran, I said, whatever happens, my back is a priority. Cancer will be there. But the back holds every life of you. If it is not well treated, then you're in problems. So Dr. Ken had a problem of balancing the equation within a K. What they did, they had to pump me with platelets, because I know any complication, any bleeding inside the spine, it will take the whole of me down. I would be paralyzed. I know. So they pumped me with platelets until they reach a level where they felt safe they can actually operate on. And I really am so grateful. The expertise of the doctors, the apparatus that investigates you, and then the team of nurses. And I'm really happy that I have had all that. I thank really honestly, okay, I had never had a shoulder hospital. I had it. Just met these people because some of the results I had sent, I gave them to Dr. Prasida. And he gave them, they shared, and but I have found a home in a home. The attention, the zeal they have shown me is really, really paramount. So far, so good. So far, I'm happy. I'm happy my battle fixed. I'm happy the cooperation of the experts. I'm happy with the cooperation of the team of nurses. I am happy I'm at the center of attention. And any hospital is not buildings which are marvelous. It is what takes place inside. It is the apparatus. It is the way to know which disease, where is it, why is it there, how did it possibly come. See, all those intertwined resolutions make people live longer. And I thank you so much, Dr. Kelly. Personally, I thank Dr. Nikhil. I thank the team.
We are really thankful for your very kind words. It is a kind of inspiration, with these kind of words when you thank the whole team which works towards the betterment of the patient. And we would wish you a very pleasant post-op period, and you enjoy the benefits of the surgery as well. Thank you, Mr. Logan.
Okay, thank you so much. So, as an example of what we were discussing, here I am exercising my walking after the back surgery, and I feel I'm doing well. The screws, the fixtures were in the right place, and I have no reason to doubt that I'm cured or about to be cured. So now you can see I'm exercising my legs, and no pain generally. I feel okay. I also wish to sincerely thank the entire team of Yashoda Hospital, both the medical experts, the general medical doctors, the nurses, the physiotherapists who walk me about here, the nurses who give me abundant drugs on which I am now improving, and I really thank the whole team. They are cooperating, they are doing a very good job, and we shall come again. And I will be able to say to some people from my home who would like to know where exactly the treatment is. Yeah.